Guys, I'm back. We're going to talk about the transmission and the science behind transmission of SARS. So, I was researching and I was stuck. You only need 1,000 copies of SARS-CoV-2 to get infected. 1,000 copies is nothing. It's just amazing that that's enough to infect someone. I put a teaser out there that how many droplets comes out of a sneeze. Anyone wants to take a wild guess? 5,000 droplets comes out of your sneeze from your nose and mouth. 10,000, 30,000, 1 million droplets. Anyone wants to take a guess? I'll pause for a few seconds. Take a guess, guys. Don't be shy. We're not gonna point out if it's way off, but it's a difficult question. So if you don't want to take a guess, it's 30,000 droplets comes out of a sneeze. And so if someone is coughing and sneezing right on your face, and they have COVID-19, your chances of getting it is very high. So that's where the face mask is a fantastic barrier in a one-to-one interaction. A lot of people ask me, what about outdoor versus indoor? So let's go delve into that. I think that's a great question which we are dealing with right now when the lockdown is phasing out. So let's give a few examples. What are the biggest hotspots in news where the COVID-19 has really, went like a bomb? One is meatpacking factories. So the meatpacking factories, why the COVID-19 went like bomb in meatpacking factory. Number one is cold. The COVID-19 loves cold. Number two is close contact. The workers are very close. Number three, the loud sounds in the factory. The communication is by yelling. So when you yell, you expel more droplets. So, those are and then the circulation, the indoor circulation of the air is very poor in most of these factories. So 6 feet not going to work there, unfortunately. You got to have better HEPA filters and more air pushed into those factories to prevent someone who, has a COVID-19 to give it to hundreds of people. So these are super spreading places. Other place we've seen in Chicago was unfortunate. They went for a choir practice in a church, and the singer had it and she didn't know it, and she gave it to about 25, 30 women, and then few died, and the singer died too. And that's again an example of an indoor space, tight quarters, the lack of circulation of air, and they're not wearing masks at that time of singing. So again, an example of 6 feet not going to work in that. So even you sitting 20 feet away from that singer, you will get it. So the 6 feet will work outdoor, and we'll come to outdoor in a minute. But let's keep going down the list of the indoor examples where we've seen it. Cruise ships, another example, though they have an outdoor space and an indoor space too, but it's very tight quarters. The circulation of the air is not very good. People are in contact with each other quite a bit. So there are two aspects of transmission. So the consensus is that it's droplet. There is some people think it's airborne, but not much studies are showing it's airborne. It's primarily droplet. So in a droplet, when I'm talking, I'm producing droplets too. When I'm breathing, I'm producing droplets too. I'm coughing, sneezing, that's a bigger droplet event. I was amazed that when you sneeze, the droplet goes at 200 miles an hour. That's, faster than a bullet train and close to a speed of a aeroplane. So really, it goes far when you cough and sneeze. Now, when you breathe, you produce 50 to 5,000 droplets, depending on if you're, running, and, then you will produce more because you're breathing deep. Now, most of the places where we had the biggest transmission is the indoor spaces, wedding, funeral, birthdays. You probably guys know about the situation which happened in Albany, Georgia, where there was a couple of funerals and they had like 20, 30 cases in a small town, rural town in Georgia, and a lot of deaths. So, one super spreader in a funeral with a lot of touching, a lot of hugging, that could lead to a lot of cases. So now we're going to be going in that phase where we're going to have to go to the social event, the birthday parties, the funerals, unfortunately, or music festivals or theater. We got to be careful. These are indoor spaces, and the cold, they are air conditioned, and the virus lasts longer here, and it's on different surfaces too. It can last for hours to days on surfaces, metal surfaces, doorknobs. So if someone coughed and they touched their hand and they touched their doorknob, now you touch it and touch your eyes. That's a short way to get it. Patty asked a question. I read the sun kills the virus. Not sure if true, because there is. So the answer to that question, Patty, is that that's why it's called novel coronavirus. What we know for sure is if you cough or sneeze on a surface which is outdoor, the virus has lipid outer lining, so it will get deformed quicker and transmissibility will be less. But we're talking formites. That means if the virus got into a surface and the surface is hard, let's say your hard car or any hard surface on the Florida roads or something, yes, then the virus, if you touch that surface, someone else touches that surface, the chances of transmission will be less. But droplet to droplet, we've not seen that to pan out in hot tropical weathers. We're getting it in a lot of countries, so it has not panned out. But I think at least it will be less from surface or formite transmission. So droplet to droplet, still it can happen. So, again, coming back to business networking, there are a lot of folks who went to, various conferences just in March before it got shut down, and they got it from there. So again, you're in a hotel, a conference room, tightly packed, and air circulation quality is poor. So those are the super spreader spaces where you got to be careful, even if the lockdown opens up, because, 6 feet distance not going to protect you. So the 90% what I analyzed of the main big events where we got a lot of cases were from indoor spaces. So indoor spaces is, and if you look at case 35, I think that was the number in South Korea. There was this lady who came from Wuhan, China, and she went to a church funeral, and she was responsible for thousands of cases. That's how they did the tracking on that. So very easily transmissible from person to person, and it's not going to change with the lockdown and no lockdown. You got to still do the precautions. But outdoor, I think you got to, you can put your guard down a little bit. If you're running or you're biking and you pass someone, you don't have enough time to inhale their virus. So you have advantage of big volume of air, getting good circulation outdoors, and you're not, unless you're standing or talking to someone very close outdoors, even without mask, then there is a risk. But if you're just passing by a biker or a runner, your risk is not as much as, let's say, you're sitting next to someone in a church or restaurant. Restaurant is another place you got to be very careful with the indoor spaces. No matter how much distance they have, it's not going to work. There is the circulation of the air is not good. So, you can get it across the tables too. If, if the vent picks up the air from one table and takes it to another table. A lot of good studies have been done on the inside design of the restaurants, and shows that it can move from one table to another depending on where the vents are pulling the air and pushing the air back. So Outdoor sitting, you're better off. You know, insist on making sure the servers are wearing masks and you're wearing masks and people around you are wearing masks. That's the only way of reducing your risk if you're going to plan to start going out. For seniors, I won't recommend it yet. You know, let's just get a little bit more knowledge of the virus, number one. Number two, let's hope that we get some more treatment modalities, antiviral medications, and the monoclonal antibody is going to be a very promising treatment, which is coming up hopefully next month or so. You know, remdesivir is there, but you know, again, it's a not a sure shot treatment. So, you know, I think the only thing we have is understand the virus better, understand the transmission of the virus better, and protect ourselves and wash our hands, not touch our faces. 6 feet will work outdoor, indoor it won't work. So it's better than you know, staying next to each other, but still it's a difficult situation with the air inside spreading from one place to another. So that's about transmission. Let's talk quickly about zoonosis and what is the COVID-19 relationship there. Before I go there, let me give you a good news. The QUIDL Corporation got a FDA approval for a antigen test, and I'm very excited about it. It's a novel test. It's different than the PCR test, which we used to, the gold standard test for finding out if someone has a virus. The antigen test, you don't need the full piece, the full genome of the virus. You can just have a small piece. So what it does is it gives you that you don't need a big equipment. For the PCR test, you need the full lab equipment, and that become expensive. So the antigen test, I'll give you example of antigen test we use right now is a strep screen in the office. That's the antigen test, very accurate. You know, if it's positive, it is positive. Now, if it's negative, that's when you need to do a PCR testing. So, you know, I think in an ambulatory setting like our office, and nursing homes, assisted living facilities, they can check their employees to see, and it could be done with a saliva test, with a nose swab, and you can do it right there and then in 15-20 minutes you'll get the report. So I think as it get rolled out into the community next 2-3 weeks, I think the antigen testing will be a game changer in terms of reducing the hot spots in indoor spaces like nursing homes, which, as you know, we got now the third nursing home, the Gulf Shore in Pinellas Park, got 20 plus cases and 1 death. And, you know, the Seminole Nursing Pavilion, the St. Mark's in Palm Harbor. I'm just talking about nursing homes only in Pinellas County, which have, a lot of cases, and we got a lot of other assisted living facilities and nursing homes here. So I think having those testing available to those facilities and doctors' offices will help to, find the cases earlier, and hopefully we can convince the patient to not to go out at all, and that should help reduce the transmission moving forward till we get more effective treatments and vaccine down the line. So the QUIDL Corporation test, I'm very excited. So let's talk about zoonosis. Now, so the answer to the question, my question I asked earlier, polio, believe it or not, is a zoonosis. It jumped from animal to human. It's not primarily was in human. So if you think about other viruses too, so Shivan did give an answer which lake she lived close to, and we are just pulling her leg. We know, Shivan, you were nervous. So the measles virus, the herpes virus, and the other the pandemic we had in last 3 decades, the HIV virus, they all jump from animals to human. So it's a very common phenomena, but interestingly in last 20 years, the corona viruses are more in news with the SARS and the MERS and now COVID-19. The reason, so Patty has a question, and I'll come back and answer that question later. Patty, let me finish my thought on zoonosis. So the reason the coronaviruses are so dangerous is the easy transmission. Luckily for SARS and MERS, they was not as easily transmissible because they had higher mortality. But the COVID-19, though the mortality is not as much as, let's say, MERS, but the transmission rate is super fantastic from the virus perspective. From the human perspective, that's awful. It became a pandemic within 3 months. That's every nook and cranny of the world except for the Antarctica, which tells you that we live in a global time with big cities and quick transportation with aeroplanes and very tight quarters where we work. So the pandemic's gonna be, unfortunately, the way of the future. And why bring it up? So why bring it up is when the pandemic goes away, and hopefully this one goes away too within a year, or once we have a vaccine, or once we have effective treatment, we forget that it disrupted us so bad that it brought our economy to the knee. As Shivan was saying, it's taking a toll on the seniors. They're staying at home, they're staying in the assisted living facilities, they're staying at nursing home, not able to hug their grandkids or their loved ones. We are social beings, and it's taking not only a financial toll, but a very severe mental health toll on just not the seniors, on everyone. A lot of suicide rate, a lot of, Kirk, the RCS CEO, was talking about domestic abuse. So, the pandemic takes a toll. So my, 2 cents on what we need to do moving forward is plug and play. So what I mean by plug and play, the scientists are working on that process, but I think with this pandemic, what it's done globally, brought the economies to the knees and, caused so much mental anguish, is that we need to have consistent effort on plug and play vaccines, plug and play treatment. So let's expand on that. So the coronavirus as a class, for example, or similar viruses like Ebola viruses, the remdesivir is a good example. These are repurposed drugs. So in other words, you come up with a drug which didn't work well for Ebola, but it worked well for COVID-19. So, so there was advantage of having that drug in our toolkit, and we could use it. And so we need to have a lot of bench research in between the pandemic on different classes of viruses to see how we can have a drug available which can be plug and play. Now, the question arises, who's going to pay for all that bench research? So that's a very difficult question and very important question to answer as a society. If you look at the cost, we already spent like $6 trillion on the bailouts, on the feds buying the bonds, the PPP programs. $6 trillion is a lot of money. Even if we spend a few billions a year and, everyone contribute throughout the world and have a good surveillance system. So if a farmer in China or India is getting sick, the pig farmer with a mysterious pneumonia, that should be a worldwide ding dong that, hey, let's pool in all our resources, not leave it to them, because once it gets out, you've seen what happened with COVID-19. Once it got out of Wuhan, we got nothing to stop it. So I think there's more need for plug and play, vaccines. There's more need for collaboration between scientists and different surveillance institutes to share the data, not be, looking at the data that's their data. Without that collaboration and accepting help in stopping where it arises and researching where it arises and, doing the quarantine measure and tracing measure in the smaller spaces, then once it's out, because with the planes, they will go out. It's not anything can stop it. So my point is, if we can work together and anticipate more pandemic, because let's look at zoonosis, why it's becoming more common now. Because, we have, 7 billion people now on planet Earth and growing. So where is the land coming from for agriculture, for building houses? is coming at the cost of poor animals. So we're getting more and more deforestation, more and more we're getting close to the animals, and wild animals are a good source of cheap protein for people living on the fringes. So what's happening is interaction has gone up, which we didn't have to. So if you look at the common thread in SARS, the MERS, the COVID-19, the common thread is the erosion of natural habitat of the biosphere. And we need to start thinking about it. The other important aspect is intensive animal farming. So what I mean by that, if you look at the Purdue's of the world or Tyson's of the world, it's not a human way to raise the pig or raise the chicken. And that's where we're seeing a lot of viruses jump. I think we need to start thinking as humans, how we're treating not only each other, but how we're treating all the other animals and other species around us. Because we think we can control it. I don't think so. I think we need to live peacefully with all the wild animals and all the biosphere. Otherwise, it will be to our detriment, and we'll get wiped out with imagine a Ebola kind of virus with transmission of COVID-19. And it's not far away. There are millions of viruses which we have not looked at, which are there in the wild. And we want to keep them there. We don't want to disturb the biosphere as much as we disturb now. We need to retract back, and we need to look at not being cruel to all the biosphere around us, because otherwise we're not going to survive as species. So that's my 2 cents on the preventing future pandemic is be kind, not just to each other as human species, but to the whole biosphere, and look at maybe meat-free Mondays. Try not using just the meat as the only source of protein all the time. Even the intensive animal farming with the pigs and the chicken are a good source of the viruses jumping, and that's how the swine flu happened. So we got to be kind to our animals and the biosphere. So having said that, let's talk about what's our how to breathe better. So we have shared in every Facebook podcast, if you didn't see the previous one, you should, different forms of breathing. I'll give you a recap what we have covered in the past. We covered the square breathing, then we covered the 4-7-8 breathing, and then we covered the victorious breath, one of my favorite. And today we're going to talk about alternate nostril breathing, or nadi shodhana, or channel cleaning breathing. So it's very simple. I think it helps you relax more. Why I talk about breathing and COVID-19, what's the relationship? It helps you reduce your anxiety about what's going on around you. And then B, it also helps you boost up your immune system in the upper respiratory and lower respiratory tracts, which is how you can, fight the COVID-19 if you are healthy, not just the COVID-19, the flu or any upper respiratory cold viruses. So let's do it. So just put your spine straight, and then put your left hand on your left knee and relax. And then, the right hand, this is the mudra you need to get in. The thumb and the ring finger and the little finger should be up, the other finger should be down. And we start by exhaling out. And then close your right nostril with your thumb. And then breathe in. And then close this nostril gently with your ring finger and breathe out through your right nostril. And breathe in through your right nostril. And close your right nostril, breathe out through your other nostril. And breathe in through your left nostril. And then close the left nostril and breathe out through your right nostril. So alternate nostril breathing sounds complicated, but the simple rule is anytime you inhale from one nostril, just close it. and do it gently with your thumb or your ring finger. And then always finish it with exhalation on your left nostril. So with that, we're going to conclude our Facebook Live for today. Try practicing it for 5 minutes. If you get congestion, then don't do it. Other than that, we'll have a very exciting show on next Thursday. We're going to have the administrator from East Bay Rehab and director of nursing from East Bay Rehab. And as you know, the hot spots in Pinellas County nowadays is COVID-19, is the nursing home and long care facilities. So we're going to get their take, how they are 5-star facility and able to keep the COVID-19 out of their building. What's their secret recipe? What's their take on what kind of help they need from federal and state government and local, medical authorities. So with that, we're going to finish our today's Facebook Live podcast. Do join us for next Thursday at 2:30, and be kind to each other and to fellow animals and biosphere, and keep the social distancing going. Thank you.